So over the last year or so, we now have a new staging system for HPV-positive patients. The reason being that the old system doesn't actually work for patients who have HPV-positive cancer. This new system is changed to the old system in a couple of ways. The clinical staging, the pre-treatment staging, now has a different nodal stage. We've got rid of A, B and C categories for stage 2, and the stages are 0 to 3, depending on the laterality of the disease. So unilateral is N1, bilateral is N2, and then if the node is more than 6 centimeters, it's N3. So it's a much more simple system. And also the actual stages themselves have changed so that clinicians may notice that what used to be stage 4, for example, in the old system, under the HPV system is a stage 2 disease. So there's a downstaging of disease. The important thing about this new system is that it doesn't mean that treatment should change. Okay, we still deliver exactly the same treatments as we were doing before. It's just that their prognosis and the prognosis group has changed. So it should not change management in any way. The other change that has happened is in the pathological staging system. So post-operatively, again, there's been a change within the nodal staging, and it's become again simpler. So there's N0, then N1 is 4 or less or fewer nodes. More than 4 nodes is N2, and there's no N3. And again, the staging classification in the pathological stage has changed, and there's a reduction or a downstaging of disease. But again, as we've said before, it really does not mean that they should have less treatment. The treatment is a separate matter, basically. And those were the changes that have happened.